Your skin is whispering a warning. Are your kidneys the reason? Most people think of kidney disease in terms of urine changes or fatigue. But what if your skin was the one trying to tell you something? The truth is, many early signs of kidney problems quietly appear on the body's largest organ, your skin, long before lab tests raise a red flag. I've seen it many times in my practice. A patient comes in with what seems like a minor skin issue, dryness, itching, or strange discoloration. They've tried new creams, changed their laundry detergent, even stopped eating certain foods, but nothing works. What they don't realize is that their kidneys may be quietly struggling, and their skin is trying desperately to speak up. That's why today's topic is so important, especially if you're over 60. As we age, kidney function naturally declines. But it doesn't always come with obvious symptoms, and here's the most overlooked truth. Your skin can be the first warning sign that something deeper is wrong. In this video, I'll walk you through 9 hidden signs of kidney disease that appear on your skin, symptoms that many seniors miss until it's too late. Some may seem harmless, others, like number 2, are easy to ignore, but could mean your kidneys are in trouble. Let's take a closer look. Your skin might be trying to save your life. So, let's begin where you might least expect it, your nails. While they may seem like an afterthought, subtle changes in your nails can be an early overlooked sign that your kidneys are struggling. Take Walter Kim, a 7-year-old retired engineer. He came in for a routine checkup, not because he felt sick, but because his wife noticed something odd about his hands. His fingernails had developed a distinct two-tone appearance, white near the base and brownish or pinkish at the top. He'd also noticed that his nails were becoming more brittle and had horizontal ridges that hadn't been there before. At first, he chalked it up to aging or poor nutrition, but Walter's lab results told a different story. His kidney function was lower than expected, with signs of mild to moderate chronic kidney disease. The nail changes he experienced weren't cosmetic, they were clinical. Known as Lindsay's nails or half and half nails, this condition is commonly seen in patients with kidney dysfunction. It reflects changes in blood flow and protein levels beneath the nail bed, both of which are regulated by the kidneys. In addition to two-tone nails, some seniors may notice spoon-shaped nails, vertical ridges, or nails that break or peel easily. These symptoms often reflect deficiencies in iron, protein, and essential nutrients, all of which can occur when the kidneys are underperforming. Walter didn't need dialysis, but he did need a major shift in his diet and lifestyle. With proper monitoring and a kidney-friendly plan, his condition has remained stable, and his nails were the first to raise the red flag. So, if you're seeing unusual changes in your nails, don't dismiss them as minor. They could be your body's early message that it's time to check in on your kidneys. But nails are just the beginning. Some symptoms go far deeper and may even threaten your skin's ability to heal. Let's look at the next one. Moving beyond the nails, let's turn our attention to a more visible but often misunderstood skin condition, calciphylaxis, a rare but telling sign that kidney function may be impaired. Meet Margaret Hines, a 70-year-old retired high school teacher who had been managing type 2 diabetes and high blood pressure for years. One summer, she noticed a painful red patch on her lower leg that quickly developed into a sore. Thinking it was a skin infection, she tried topical creams and home remedies, but the lesion only worsened, becoming dark, swollen, and increasingly tender. By the time she came in, the wound had turned black at the center. Tests revealed Margaret had stage 3 chronic kidney disease, and what she was experiencing was calciphylaxis, a condition where calcium builds up in small blood vessels, cutting off circulation to the skin. This causes localized tissue damage, resulting in ulcers that are slow to heal and extremely painful. Calciphylaxis doesn't affect all patients with kidney disease, but it's more likely when other factors like diabetes and imbalanced calcium-phosphorus levels are also at play. In Margaret's case, her kidney function had quietly declined, and the signs only showed up after the damage had begun. Fortunately, with wound care, dietary changes, and close nephrology follow-up, her skin slowly improved. She didn't need emergency surgery or advanced interventions because she came in when the signs became persistent. This story serves as a crucial reminder. If you develop skin sores that don't heal, especially if you have chronic conditions like diabetes or hypertension, don't assume it's just poor circulation or age. It may be your kidneys warning you that something deeper is wrong. And when circulation is affected, healing isn't the only issue. The next sign involves your skin reacting to toxins from the inside out, sometimes in the most unexpected ways. While some skin problems come from blocked blood flow, others are caused by toxins your kidneys can't remove, and they show up in ways that may look strange or even alarming. That's what happened to Juan Alvarez, a 65-year-old retired woodworker who woke up one morning to find a fine white powder across his shoulders and back. His wife thought it was dust from the attic, or maybe a skin condition like psoriasis, but as they wiped it away, more kept forming. It looked like frost, but it wasn't cold. Juan felt fine otherwise, no fever, no pain. But when he came in for evaluation, his blood work revealed dangerously elevated ura levels. His kidneys were no longer able to properly filter out waste, and what the body couldn't remove through urine was coming out through the skin. This condition is known as uremic frost, and while it's rare today, thanks to earlier diagnosis and treatment of kidney disease, it still occurs in advanced cases where toxins build up in the bloodstream. Frost appears when high levels of ura excreted through sweat and then crystallize on the skin surface as the moisture evaporates. It's most common on the face, neck, and trunk. For Juan, this was his first clue that something serious was happening internally. Though he didn't feel sick, his lab results showed stage for chronic kidney disease. He was immediately placed on a kidney-safe diet, hydration protocol, and close nephrology monitoring. Thankfully, he didn't yet require dialysis, but he came close. Urst is your body's last resort, a way of expelling waste when the kidneys have stopped keeping up. If you ever see white powder-like crystals on the skin of someone with kidney issues, it's a sign to act quickly. But not all symptoms look so dramatic. The next one is subtler yet can tighten your skin and your mobility. Sometimes without warning. Sometimes your skin doesn't just itch or show a rash. It changes texture completely, becoming tight, stiff, and uncomfortably thick. And surprisingly, this may not be from a skin condition at all. It can be a sign that your kidneys are involved. That was the case for Harold Young, a 72-year-old retired Navy officer. A few months after undergoing an MRI with contrast dye, Harold noticed his skin, especially on his lower legs and forearms, becoming unusually firm and shiny. At first, he assumed it was dry skin or a reaction to soap, but lotions didn't help. He soon found it harder to bend his knees and elbows, and the tightness made his movements awkward. When he finally sought care, a skin biopsy and lab work revealed a rare condition called nephrogenic systemic fibrosis, or NSF. NSF typically affects individuals with underlying kidney dysfunction who have been exposed to older forms of gadolinium-based contrast dyes during imaging studies. The condition causes collagen to deposit excessively in the skin, leading to thickening, hardening, and even a woody or orange peel texture. In Harold's case, his kidney function had been mildly reduced for years. He was stage 3 CKD, but it hadn't been closely monitored. After the MRI, the contrast triggered a delayed reaction, and NSF began to progress slowly over weeks, though the condition can be debilitating. Harold was fortunate. Early detection, physical therapy, and kidney protective measures helped slow the progression. The key takeaway here is this: Skin stiffness or mobility limitations in seniors should never be dismissed, especially after medical imaging. If your skin feels unusually tight, glossy, or firm to the touch, and if you've had recent imaging procedures, it's worth discussing with your doctor, particularly if kidney issues are already known or suspected. Still, not every kidney-related skin sign causes tightness. Some show up as patches of strange color or slow-healing sores. And in the next story, that's exactly what we'll uncover. While some skin symptoms feel dramatic, others are so subtle they blend into everyday life. Skin discoloration or wounds that take too long to heal can easily be dismissed as signs of aging, but they may point to something deeper. Deborah Cole, a 68-year-old retired illustrator, noticed her skin was becoming darker in patches, especially on her forearms and around her ankles. She also had a small cut on her shin that stubbornly refused to close after several weeks. At first, she assumed it was just dry skin and poor circulation. She tried moisturizers and ointments, but nothing helped. When she finally saw her doctor, blood tests revealed stage 2 chronic kidney disease. Deborah's discoloration and delayed healing were not cosmetic, they were biochemical. When kidneys can't remove waste properly, toxins build up in the blood, affecting skin tone and tissue repair. In her case, elevated phosphorus levels contributed to the pigmentation changes, while decreased circulation slowed her healing. Skin darkening in kidney disease isn't always uniform. Some people develop a yellowish or grayish tone. Others, like Deborah, see patchy hyperpigmentation that may resemble bruising. These changes can result from uremic toxins, electrolyte imbalances, and nutritional deficiencies, all of which become more likely as kidney function declines. Slow wound healing also deserves attention. Reduced blood flow, anemia, and protein loss can make even minor injuries take longer to repair. For seniors, this can increase the risk of infection or skin breakdown if left untreated. Deborah didn't require intensive treatment, just targeted changes to her diet, hydration, and follow-up with a nephrologist. Her symptoms improved over time, and she learned to recognize these early signs as her body's quiet call for help. Discoloration and slow healing might be easy to ignore, but they're powerful signals. And the next one is just as common, except it often shows up around the eyes, feet, or fingers. Sometimes your skin doesn't need to change color or texture to send a warning. It simply swells quietly, gradually, and often in the most overlooked places. This is exactly what happened with Samuel Pierce, a 66-year-old former bus driver. He began noticing puffiness around his eyes in the mornings and occasional swelling in his ankles after long days. He assumed it was just part of aging, or the salty snacks he enjoyed before bedtime. It wasn't until his wedding ring felt tight and his shoes no longer fit comfortably that he paid closer attention. A routine physical revealed that Samuel had early-stage chronic kidney disease. His kidneys were still producing urine, but they weren't effectively filtering excess fluid and protein. The result? Water retention, especially in soft tissues like the eyelids, hands, and feet. This type of swelling, called edema, is common in kidney dysfunction. When the kidneys fail to regulate sodium and fluid balance, fluid leaks into surrounding tissues. At the same time, if protein leaks into the urine, a condition known as proteinuria, blood vessels lose their ability to hold fluid inside, which leads to even more swelling. The swelling in Samuel's case wasn't painful. It wasn't dramatic, but it was persistent, and that's what made it meaningful. With a kidney-friendly diet, better blood pressure control, and consistent follow-up, his condition stabilized before advancing further. Edema often hides in plain sight. Puffy eyelids, socks leaving deeper impressions, hands that feel stiff in the morning. If these signs are new, frequent, or slowly worsening, they may be pointing to something beyond hydration or salt intake. Your skin once again becomes a messenger, not through rashes or scars, but through the gentle push of water where it doesn't belong. And that brings us to our final symptom. One that's often the most bothersome of all, yet so easy to overlook until it becomes unbearable. Now that you've seen all 9 skin-related signs of kidney disease, let's take a step back and reflect. These symptoms aren't always loud or alarming. In fact, most of them are subtle. Dryness, color shifts, swelling, or nail changes. That's why they're so often ignored, especially by seniors who may attribute them to just aging. But, as we've seen, your skin can quietly reveal what your kidneys are silently struggling with. Walter Kim, who we met earlier, serves as the perfect example. He had no pain, no major complaints, just a change in the appearance of his nails. But that one detail led to early detection of kidney dysfunction with a few lifestyle adjustments and medical guidance. Walter has been able to stabilize his kidney function and avoid further complications. It all started with observation and taking the time to care. That's the power of awareness. You don't need to be a doctor to notice something unusual on your own skin. You just need to be curious enough to ask, why is this happening? And that one question could make all the difference. If you're over 60, this is the time to take your kidney health seriously. Don't wait for painful symptoms. Look for the quiet warnings on your nails, your skin tone, your hydration levels. Bring up any concerns with your doctor. Get your creatinine and GFR checked annually. And most importantly, trust that your body is always speaking to you. It just takes a little listening. So let this be your reminder. The earlier you notice these signs, the better your chances of slowing or even reversing kidney damage. Prevention isn't about fear, it's about empowerment. If this video helped you spot something in yourself or in someone you love, please share it. Leave a comment with your thoughts or questions, and of course subscribe for more science-backed advice on aging wisely and living fully. Hey,